Hi, I'm Tina with the Zirc's Clinical and Efficiency team. Today, I want to show you how to use Mr. Thirsty one step. Mr. Thirsty is a solution for your high volume evacuation and isolation. It comes in 3 sizes: small, medium, and large. They're color coordinated so you can easily identify which mouthpiece is going to work best for your patient. Understand that these devices are customizable. So if you have a patient that you've picked a particular size for and you need to adjust, simply grab a scissors and trim around the perimeter if needed, because you will not compromise the suction and the integrity of this device. Let's talk about placement. No additional equipment is needed with this device. Simply plug and play. Attach it to your HVE. For placement, I would bend over the cheek retractor. We'll ask our patient to open. We're gonna roll it in and we're gonna focus on placing that bite block, have our patient close, and simply pull the cheek retractor over to the other side. We've now isolated the tongue. We can work on upper and lower left-hand side as well. If you need to move, simply have your patient open. You will rotate the bite block and flip your suction device and go ahead and place on the opposing side as well. This can take a little bit of time to get used to, so I'll encourage you to go ahead and try a couple of times. Do it with a colleague, place it on some patients, but have confidence in knowing that you can customize this for the perfect fit to help with your high volume evacuation.